How to choose a good dentist? First of all, do not allow Google to choose a dentist for you. You can go with word of mouth, maybe, or you can visit the dentist who is nearby to you. Nearby dentist is very important because dental appointments are usually multiple. So always traveling, if you think that you have to travel a lot, you might end up avoiding the going to the dentist. So first factor is choose a nearby dentist. Go to the dentist yourself and see for some of the factors which I am telling. Number one is hygiene. The dental setup should be hygienic. The consulting table, the hygiene starts from the doctor's consulting table. Consulting table should be clean. The doctor should be technologically, he should have all the, if not all, he should have the basic technology required. Basic technology, like the most basic thing that the clinics in a city like Bombay nowadays should have something called the dental RVG, which is a X-ray that can be connected to the laptop, and immediately it can show it to you on the screen, the dental X-ray. At least for one or two teeth, you can take that X-ray. Then comes dental OPG, which gives a full mouth X-ray. Then comes something called CBCT, but all those are costly affairs. But the base minimum criteria is the dentist should have a dental RVG in the clinic. First point that I told was good hygiene. Then comes the how the dentist sees you. The dentist should see you as a whole person. As we earlier also spoke, he should treat you holistically. He should track your dental history. He should also know your medical history, because some of the medical problems like hypertension and diabetes are closely linked to your dental health and treatment perspective as well. Like if a person on blood thinners, I cannot just go and extract his tooth. I need to consult his physician if the blood thinners can be stopped prior, or if the blood thinners cannot be stopped, I should be ready with my armamentarium to stop the bleeding if required. That is where the patient's previous dental and medical history becomes very important. If the dentist is asking about these questions, if the dentist is trying to treat you as a whole person and not just that one single tooth that is paining. After that comes, after the case history examination, the dentist should explain all the procedures that he is planning to do. He should explain what condition you have. He should show you the X-ray. He should explain why it has happened and what is the solution, and also be able to give you multiple options. That these are the solutions. Now you choose. Ultimately, the patient should be the one choosing. That okay, if I don't have a tooth, I can also go with a partial denture. I can go with something called a bridge. I can go with something called an implant. These are the different costs. These are the different appointment times, and this is the life of that prosthesis that we are using. So see if the dentist is giving you good enough time in the consultation. ऐसा नहीं कि आया, हाँ ये पेन है, ये दवाई लो, ये दांत निकालो, घर जाओ. वैसा प्रैक्टिस में try to avoid Google reviews. Yes, it can help you somewhat, it can give you an idea, but don't trust it completely. Go to a nearby dentist, look for good hygiene, look for a dentist who is giving you time, who has the basic technology available. And in today's times, most important factor, go to a dentist who runs his dental setup like a polyclinic. He has other dentists coming in. The earlier branches that we spoke about, he should have all of them on the panel. Because the earlier system where one teacher used to teach all the subjects is over now. Now there are teachers specific to subjects, and for biology there is a different teacher, for maths there is a different teacher. Then when it comes to your body, why are you compromising? For a root canal, you should have one MDS endodontist. For your tooth rehabilitation, you should have a prosthodontist. For your child, you should have a pedodontist. For your gum surgery, you should have a periodontist. And for all your surgical work, you should demand from your dentist that I want a maxillofacial surgeon to come in and do it. If my wisdom tooth is to be removed, I want the best person to do it, because ultimately it is a surgery and it is my body. So I deserve the best. So the last point is the dentist should have different specialists coming in on the panel. Even if he is doing it, he should have someone available if something goes wrong.